Hey, I am here to answer a question that was submitted from one of the members of the Rebel Minds Learning Collective, and so I'm here to record it. The question was how to address and work through shame with clients, especially when there's some resistance or willfulness showing up. What to do when a client internalizes and struggles with separating from the shame or says that they don't want to separate from it. So I think it's a really great question. I think shame is a really difficult thing to work with. And so I have a couple of thoughts that I'm going to share. So the first one is to always consider DBT. I always consider DBT like a dance. And so a dance requires movement that's very fluid. And so when I come into session, I'm thinking about how I'm entering into the dance. And when I'm interacting with a client, I'm thinking about, okay, how am I entering in with this dance? And so generally, almost every interaction is going to start with an acceptance strategy. For individual sessions, that's going to look like just a warm greeting. Hey, how are you? It's so good to see you. In this scenario, it's likely going to look like validation. And so the reason I come back to this dance strategy is because, of course, as a therapist, you probably really want to be able to help your client unload this burden of shame that they've been carrying. But it's very easy for us to get really change focused and just start digging in on strategy to help them let go of the pack of shame that they're carrying without really considering how hard it might be for them. So a really great place to start, my first tip would be with validating the task difficulty of letting go of shame, or even the task difficulty of experiencing shame. Shame is one of those emotions that communicates to us that whatever we're doing wrong, or maybe we're not doing something wrong, but what shame is telling us is that we're doing something wrong. And because of that behavior, we're going to be outed or exiled from the pack. That's the function that we have shame. And so shame has really good intentions. And so it makes sense to me that this client is having a hard time letting it go for a lot of reasons that I won't, assume that I know what they are, but I can just imagine how tricky it is to let go of shame because shame is working really hard to convince this person that they can't do whatever behavior they're doing, that they shouldn't be doing it, or that they just shouldn't be that way. And so while shame likely has really good intentions in this scenario, if shame doesn't fit the facts here, and I often think shame does not for a lot of our clients, like they may feel shame, but just for kind of existing, then it's something that we want to help them move through, and we want to help them understand more about shame and what shame's motives might be, right? So the motives might be good from the perspective of shame, but it's probably not helping them in the long run to really build a life worth living. So I want to start with validation, and then I'm going to help them move into observing and describing. So we're still in mindfulness. And the reason that I want them to use their observe and describe skills is because I want to have a really clear picture of what it looks like when shame is activated for this person. I want them to have a really clear picture of it too. So remember, observing is noticing and sensing, and I want them to notice and sense. And so we might even do this together in session, especially if I can see the shame showing up. I might ask them, can you just notice what it feel when did it just come? Did it just start? Did you feel it? Is it here now? Is it here with you? Is it here with us? And if the answer is yes, I would ask them if they're willing to start putting words to that, to start describing that experience. They can do it to themselves privately. They can write it down. They don't have to share it with me. That would be really hard, again, because we're talking about shame. But I want them to get a sense so that way they know when shame is activated, when shame is in the room, and that I'm able to have a sense of that as well. So I want them to notice what is happening for them internally when shame is present. And then I might even use a metaphor. So I remember having this conversation with a client previously years ago, where we would talk about how shame was so deeply ingrained with their identity that they didn't really have to think about it too much. Not much really had to happen. They just had to wake up and they felt shameful, right? So going back again to how difficult it would be for somebody to start uncoupling themselves from shame when this has been their experience for maybe their entire lifetime, whether it's justified or not, it would be really hard to let that go. And so we had this metaphor of you wake up and you get out of bed and you get dressed and you put your shame sweater on and you don't even really think about it. Like there it is, you get up, you grab it off the hook, you put it on, and then you go about your day from that perspective. So using a metaphor is going to be a nice way to ease in without going straight to change strategies and targeting it. When it's already something that's a little bit, I don't want to, my first thought was delicate. But I think it would just be really hard to jump into something. You're saying that this client isn't open to changing it right now. And so I wouldn't want to go full on change just yet. I would use something like a metaphor to help move us in that direction. Okay, so we talked about validating the task difficulty, talked about observing, describing the experience to get a sense on it. The other thing that I forgot to mention about observing and describing is I'd really like to name that shame as like a part of themselves versus their entire selves. One thing that I see with clients who are really internalizing and just waking up and putting on the shame sweater, again, is that they don't even really think of it and they attribute it to them their whole selves. And so what I want to start to do is to help identify shame in their body when it's activated as a part of them versus their whole selves, because it's a lot easier to work with one part of you than your whole self, right? So if we can identify times when wise mind is activated, if we can identify times when, maybe anger or fight part is activated, getting really curious about that part, the shame part, when it's activated, what it's like, what it feels like, where it lives in the body, all of those things I think are going to make it much easier to work with, as opposed to targeting, going in really strong with change strategies to you, your whole self, the client. It's like, okay, let's get curious about this part of you as opposed to you living in this. This is another sneaky, subtle way that I'm working with the client to break out of this identity without invalidating them, without making the task something that's like really hard, like in it, unimaginably difficult, and also without reinforcing the narrative that shame is the entire, like they are shame, right? So if I keep treating it that way, then it's kind of reinforcing it without me even wanting to do that or without me even being conscious of that. Instead, I'm able to say, okay, well, you have this part of you, right? So I'm kind of helping them along the way by doing that as well. I mentioned curiosity. The fourth thing that I would do is get really, really curious about that shame part. So we're starting to move into change strategies, right? So I might do behavior analysis, behavior chains on when change shows up, when shame shows up, when it gets activated. And again, think of the chain analysis. The function of a chain analysis is to really understand something, right? So if we're wanting to really understand shame, if we want to move it, we have to get really curious about it. Like, what are the conditions when shame tends to show up? And when I think of conditions, I think we're trying to figure out what's the environment like what gets this person queued up, what gets this part queued up to be living in its prime. I think of the conditions in general, right? So like a good way to think about this is, for me, if I want to go outside and I want to go for a run, I want to go on a sunny day when the air is pretty clear. I don't want to go on trash day. I don't want to go on a hot, sunny, humid day. I want to go when it's pretty light outside. Those are the conditions for a great run. And so you want to be thinking, what are the conditions that shame is thriving in? Is it always alone in your bedroom at night? Is it generally when you're around your family? And I'm speaking for this questions that I would be asking the client. We want to get really curious, almost like detective mode, to figure out, where does shame really thrive, and what does it need in order to live and to keep going? So what is it that's feeding the shame, and what is it that it's trying to do? So one of the things that you had said was the person's really seeming resistant to letting it go. So I would want to know about that shame part, and I would want to know, what is it afraid of, and what does it feel like it needs to protect, if it's scared of letting go. I would also want to know, who is resistant to letting go. Is it you, client, your wise mind self, or is shame activated and saying, no, I can't let this go, right? Because shame, again, has this quality of kind of like, again, with good intentions, it generally wants to protect the person, but it's often working under false pretenses. And so we want to be, us therapists, we want to be activating wise mind in that client as much as possible to help them be able to almost imagine that myself and the client are in session. And I want to tell the client, imagine you're standing outside of this and you're watching us through the window have session. What would you be seeing? That's the mindset that I want to get the client into. So I want to get really curious. I might use chain analysis. I really want to work on activating wise mind with that information we've gathered from the mindfulness practices to observe, describe, to give a name to that shame part, to better understand why is it here, what are the conditions it generally shows up in, what does it need, and what's the threat in letting go. The last thing is you can also take an embodied opposite action approach. So generally when we think of opposite action, we think like, okay, well, what's the urge, but do the opposite. So now I'm thinking, if you have this client who's waking up, they're putting their shame sweater on and they don't even really think about it, it's just kind of part of their life and is starting to become part of their identity, then as the clinician, you probably can see when it gets activated. I know for my clients and for folks in general, when shame is activated, they start getting really small. So their tone might even be getting lower. They start curling into a little ball. They start sinking down in their seat. And so again, going back to my second point here of observing, describing, starting to understand that, when they start to understand that, they're going to be able to, if they want to, if they are committed to targeting shame. So in all of this, right, somewhere in there, we're trying to increase, number one, like, why is shame problematic for this person? We're trying to help them understand that. What would their life look like without shame? I have to increase their buy-in before I target it, right? Because if they're not on board with targeting it, it's just going to feel kind of like, I don't know, wasted air every time I talk about decreasing shame. So if we don't figure that out together, which a lot of what I'm talking about today is about figuring it out, understand it, and then adjusting your approach to that need, to those conditions of shame, then, none of it's going to work. And so my hope is that you're assessing, you're getting some sort of commitment to target it and to bring the shame down. Once they're in that place, you could use an embodied opposite action approach where they're noticing that shame's becoming activated, and then they're using their body as an intervention to change the way that it's feeling, to decrease that feeling of shame getting activated. And so what might that look like? That might mean that when client is sinking down in their chair, they just see what it feels like to just lift their chin up just a little bit. See what that feels like. So take a deep breath and to bring air and breath all into this space that's probably tight and constricted. And to start to put one arm down and then maybe another. And maybe they even sit in a willing hands seated position or a willing hands stance. And maybe they bring a half smile to their face. You can kind of build on from that. But my last point, again, depending where the client is in their willingness to target it, and maybe it could even be used as an intervention to just, hey, let's see what it feels like when shame's not around. If it's here all of the time, like, I mean, what do you have to lose, right? You could try that as well. But I'm thinking about helping the client to understand that emotions really love themselves, as Marcia says. So whatever it is that's triggering shame to come to work that day, to pop up, what's keeping it there? Some of those things are going to be the conditions, right? The environment, but also think about what's happening for this person internally. If shame looks like this in the person's body, it's going to be really hard for it to stay there when they start to sit up straight. They pull their shoulders together. They start to pull their chin up. They start to breathe air into the space. They start to open up their heart. It's going to be hard for shame to continue when they make that change. So thinking about an embodied approach to opposite action is another way that I would go as well. I hope this helps. If you have any other questions, you can send them directly to me, and I'm happy to talk more to you about shame and how it shows up in your session. Also, let me know how any of this stuff goes. I'd really love to hear if any of these interventions worked out for you and your client. Good luck.